Good morning everyone. So today we will be discussing about the anatomy of the facial nerve. So facial nerve, it arises from between the pons and medulla. Once it arises, it crosses into the internal acoustic meatus. So traveling in the internal acoustic meatus, it enters into its first genu, which is in the posterior wall of the middle ear. Before it enters into the first genu, it gives off its first major branch, which is known as greater superficial petrosal nerve, and this branch, it goes to your lacrimal glands on both sides of your lacrimal glands. After it enters into the middle ear, and when it enters from the first genu and it travels on the posterior wall, it then exits through the second genu and then it comes out. But before exiting the middle ear, it gives off two branches. One branch is the chordae tympani branch, which goes and supplies the anterior two-thirds of your tongue, as well as the sublingual and the submandibular glands. Another branch it gives is from here to the stapedius muscle, which is also known as nerve to the stapedius. After it exits from the second genu, it passes through the parotid gland. Please remember, it only passes through the parotid gland, and then it gives off 5 branches, which you can remember with an easy mnemonic. Which can help you remember it. So this mnemonic is in the Urdu language. It's called Tum Zyada Bakwas Mat Karo. So Tum stands for temporalis branch, which goes to your temporal muscles. Then there is the zygomatic branch, which goes to the zygomatic arch. Then there is the buccal branch, which supplies the buccal muscles, and mandibular branch, which supplies the mandibular muscles, and finally the karo, the cervical branch, which supplies the cervical muscles. So this is very briefly the entire anatomy of the facial nerve. Thank you for watching.